Most people think neuropathy is one problem. It isn't. Two people can both be told they have neuropathy and have completely different nerve fibers being affected in different ways. And if nobody identifies the pattern that they're dealing with, the treatment becomes guesswork. So stay with me over the next 15 minutes because I'm going to show you 4 real patient patterns, and I bet at least one of them sounds familiar either as you or as someone in your family that you already started watching a little bit more closely. And by the end, you'll understand why neuropathy can look completely different from one person to the next and why that matters so much. Now let's start with the first pattern. We're going to call this the burning pattern. I had a patient whose feet felt like they were on fire every single night. Not figuratively. She described the pain as standing on hot coals. The sheet touching her feet were unbearable, and it always got worse after midnight. When I asked her what bothered her most, it wasn't actually the burning. It was that she was exhausted. She wasn't sleeping. And after months of not sleeping, everything in her life started to suffer. Her patience, her work, even her relationships. The burning was a symptom. The exhaustion was the real cost. She went and got all the standard nerve testing done. The test that most doctors order first, and it came back normal. She was told everything looked okay. Here's what nobody explained to her. The standard nerve tests we use are so much better at evaluating larger nerve fibers than the smaller ones. So it is possible to have severe, real escalating nerve pain and still have normal test results. This is why some people have severe symptoms and a completely normal nerve test. Not because nothing is happening, because a test was never designed to answer every neuropathy question by itself. One thing I've noticed over the years is that patients get confused when the test and the symptoms don't seem to match. They'll tell me everything came back normal, but I still feel it every day. And that's exactly why understanding what a test is actually measuring matters. A test is a measuring tool. If the symptom and the test don't seem to agree, sometimes the next question isn't whether the symptoms exist. Sometimes the next question is whether the test was measuring the thing you were actually trying to understand. What finally moved things forward for her wasn't a new test result. It was finally understanding why the old result didn't explain what she was experiencing. Once she understood that, she stopped questioning herself. She stopped feeling like she had to prove what she was experiencing to everyone around her. And that changed the conversation moving forward. Now, let's look at the second pattern, and we'll call it the falling pattern. This one is almost the opposite. And honestly, it's the one that scares me the most when I see it. Different patient, almost no pain, but he stopped walking in the dark. He looked down at his feet every time he walked because he couldn't tell exactly where his foot landed unless he was looking at it. When I asked him what he noticed the most, or when he noticed it the most, he said is when he took a shower. If he closed his eyes to wash his hair, immediately he felt unstable. The second he closed his eyes, the instability showed up. That's something that we see often. People don't realize how much they're relying on their vision until it's taken away. And as long as they're looking where they're stepping next, they mostly feel okay. Then they close their eyes in the shower. They get up in the middle of the night to use the bathroom, or they have to walk through a dark room, and the instability becomes obvious. Now, the problem didn't suddenly appear. The compensation disappeared. No burning, no fire, just numbness, instability, and a gradual loss of the signal that tells the brain where the feet are in space. Now, this is a dangerous one because it doesn't hurt enough to scare people into getting help. Pain is what gets people into the doctor's office. Numbness and imbalance get people into a hip fracture 18 months later. And by the time that fall happens, everyone acts surprised. The reality is the warning signs were usually there for years. When I asked him why he hadn't brought this up sooner, he said he didn't think the numbness counted as a real symptom. He'd been waiting for it to start hurting before he actually took it seriously. And that's the trap with this pattern. The body's normal warning system, pain, isn't it's not what gets the attention here. So people wait for the signal that may never come while the actual risk continues to build underneath. Now sit with that for a second, because that's the entire point of the video. The person with the most pain is not always the person with the most nerve damage. Now listen to that again. The person with the most pain is not always the person with the most nerve damage. The woman with the burning feet, she was in agony, but her balance was intact. The man who could barely feel his feet was in almost no pain at all, and he was the one at the real risk of falling. Pain and damage are not the same measurement. They operate on two different systems, and treating one like it's the other is how people fall through the cracks. I sat with both of those patients in the same exact room on different days. One was overwhelmed by the pain. The other almost felt like he didn't have enough symptoms to even talk to me about. If you only listened for who sounded worse in the moment, you would assume the burning patient was worse off. And she wasn't. She was suffering. He was the one at risk. And that distinction matters. One of the biggest mistakes I see is assuming the loudest symptom is automatically the most important symptom. Now, sometimes it is, but sometimes it isn't. I've seen patients whose biggest complaint was the burning, while their balance was relatively preserved. And I've also seen patients with very little pain who were already changing how they walked, where they walked, and what they felt comfortable doing. That's why we have to look beyond symptom intensity and pay attention to function. Now let's put a name to these patterns. The burning pattern is what is usually we call small fiber involvement. These are the nerve fibers that help you feel pain and temperature. The falling pattern is usually large fiber involvement. These fibers help your brain know where your feet are in space and why balance starts breaking down first. It's also why these symptoms often start in the feet and gradually work their way upward. The longest nerves are often the ones that show up first in terms of trouble. And when both systems are affected, things start to get confusing. Patients can have burning, numbness, instability, weakness, and balance problems all at the same time. And the reason this distinction matters is because these patients often present differently, progress differently, and sometimes require different testing to better understand what's actually happening. I started asking almost every neuropathy patient of mine the same two questions. What bothers you the most? And what have you quietly stopped doing? The first answer often tells me what the symptom burden. The second question usually answers about their function. And it's often the second question and the second answer that tells the bigger story. Now let's talk about the third pattern, which is a mixed pattern. This is the one that we actually see most often, and is probably the most commonly mismanaged. This patient had both. He wasn't sleeping through the night because of the burning, and during the day, his balance wasn't reliable anymore. He's been treated, but only for the pain. He took medication for the burning, but nothing at all for the balance. The interesting thing that he believed that the burning was the biggest problem. But when he started talking, he admitted to already changing the way he lived. He parked closer everywhere he went. He avoided uneven ground and grassy surfaces. He grabbed the railings that he never used to have to grab when walking. And none of that came up when he described his symptoms. Because to him, those weren't symptoms. They were just the way he had to live. And that's the thing about loss of function. It really announces itself all at once. Most of the time, it shows up as small adjustments that most people, they kind of rationalize why it's happening. Then one day you realize you built a day and built a life around things that you avoid without even thinking about. So on paper, he was being managed, but in reality, half of what was happening to him wasn't even being addressed at all. And the part that wasn't being addressed was the part that could eventually put him on the ground. When you only treat the symptom that's the loudest, you can miss the ones that are actually the most dangerous. Now, let's look at the fourth pattern. This is the early pattern. This is the one that often never makes it into a doctor's office because it doesn't look serious yet. The person usually tells me the same thing. Oh, it's not that bad. Then when I ask when it started, they tell me 5 years ago, 7 years ago, sometimes even 10. They've been living with it for so long, it stopped registering as something worth even mentioning. The most dangerous neuropathy patient isn't always the one suffering the most. Sometimes it's the person who notices occasional tingling and assumes they'll deal with it later. The challenge with early neuropathy isn't that people ignore it, it's that the symptoms are so easy to explain away. Maybe it's age. Maybe I just stood for too long. Maybe it's stress. Maybe I just wore a pair of bad shoes today. There's almost always a reasonable explanation available. Because by the time the numbness reaches the balance system, years may have passed. What felt like nothing, maybe a little tingling, something easy to dismiss, may have quietly been progressing this entire time. This is the pattern where catching it early can completely change the trajectory. Because by the time it's obvious enough to get tested and diagnosed, you're often further along than anyone realized. I'll ask one more question with this group almost every time. Has anyone else in your family dealt with something similar? Maybe a parent or a grandparent or an older sibling? Most of the time, the answer is yes. And often, that's the first time they've connected the dots between what happened to someone else and what may be already starting in them. So here's the question I want you to sit with. Which pattern sounds most familiar? Are you the burning pattern? Pain and temperature sensitivity, but still steady on your feet? Are you the falling pattern? Numbness, instability, and balance problems, but not much pain? Are you the mixed pattern where one part has been treated and the other has been ignored? Or are you still early? Mild symptoms that everyone, including you, have been brushing off. I'll tell you what I notice when people realize which pattern they fit. It's usually not a surprise, it's relief. Most people have already sensed that something doesn't quite add up. The test says one thing, but their body says another. Or they've quietly rearranged parts of their life around the problem nobody put an actual name to. Hearing it explained often feels like the first time pieces actually fit together. This isn't really about the label neuropathy. That label doesn't tell you which systems are being affected. The pattern does. And if you've been told you have neuropathy and the explanation stopped there, no discussion of pattern, no discussion of function, no discussion of risk, then that's not really a complete picture. It's the beginning of the conversation, not the end. Because what you actually want isn't a diagnosis. You want to sleep without your feet feeling like they're on fire. You want to walk through your own house without thinking about every step. You want your confidence back. You want your independence back. I hear some version of the same sentence from almost every patient. I just want to feel normal again. Not cured in some abstract sense, just normal. Back to not thinking about it all day. Back to grabbing their keys and walking out the door without calculating the route, the lighting, or the surface that they're walking on. Almost nobody walks in asking for better nerve function. They ask to walk the beach with their spouse again, to play with their grandkids, to travel. Ultimately, to stay independent. The goal is almost never the nerve itself. The goal is the life attached to it. And one reason it's so difficult to get back to that life is that nobody mapped which pattern you're actually dealing with. Your nerve environment broke down in a specific way, and a generic treatment plan can't solve a problem it was never designed to identify. The woman with the burning feet doesn't necessarily need the exact same approach as the man who stopped walking in the dark. Treating them identically is one of the reasons so many people spend years moving from appointment to appointment without meaningful progress. The cycle is exhausting. New appointment, same questions, same test, same uncertainty. Most of the people I meet have already been through the loop multiple times before anyone ever explained their condition in a way that makes sense to them. Here's what the other side looks like. It's not dramatic. It's ordinary. You walk in from the car. You're standing in your kitchen, and you realize you didn't brace for the burning. You didn't grab the counter. You didn't think about your feet once. The fear is pretty much gone. That's the moment. Just your life quietly coming back. I've had patients describe that exact realization almost word for word. Not in a doctor's office, not during a test, in their own home. Doing something completely ordinary. That's the outcome they're really chasing. And that's what the 360 neuropathy system is built to do. Figure out which pattern you're dealing with. Identify which systems are contributing to it, and build a plan around that specific pattern. Not a guess, a map.